Bonjour Karen. Euh,
Bonjour.
je suis ravi de vous accueillir aujourd'hui. Donc, je vais commencer par vous présenter rapidement en français. Donc, Karen, vous êtes une physiothérapeute avec une carrière de 20 ans. Vous êtes installée en Australie, du côté de Melbourne. Vous êtes passionnée par la santé et les nouvelles technologies. Donc, vous êtes également directrice d'online physio, un cabinet de santé entièrement en ligne qui est spécialisé dans les téléconsultations en physiothérapie. Donc, grâce à ce succès d'Online Physio, vous êtes également une personnalité influente dans le domaine de la télésanté. Vous êtes un membre fondateur de la Société internationale de médecine digitale. Vous êtes présente à des conférences en Australie et également à l'étranger. Et vous êtes même conseillère en santé numérique auprès de différents organismes et établissements de santé. So, Karen, I will switch now in English. And I got a first question
Merci,
for
thank
you.
you.
So you're a physiotherapist, which is different from masseur kinésithérapeute in France. Could you explain your everyday job and how is it different from a kinésithérapeute?
Yeah, so I think probably the best way to describe physiotherapy is that we basically look at the interaction between all three systems in the body, the skeletal system, the muscular system, and the nervous system. And if people have issues with their body, we assess, we diagnose, and then we create a management plan for that. Now, probably a lot of that sounds familiar to your community. I guess one of the key differences is that in Australia, patients don't require a referral to come and see us. We are first contact service providers, so people can come straight to see us. So that's probably one of the key differences here. But otherwise, very similar in terms of our work with the musculoskeletal system, our pathway of assessing, diagnosing, and treating. And we also have probably similar specialties too. So I specialize in musculoskeletal injuries, but people can specialize in pediatrics or in neurological conditions or in disability. So there are a lot of different specialties as well. And we also can work in private practice settings, hospital settings, and community settings, but mine is the private practice space.
Okay, okay, quite clear, quite clear. But as a woman, Karen, what happened to you, and also as a physiotherapist in 2008?
Yes, so that was a very interesting year. I had just completed my master's in musculoskeletal physiotherapy. And when I was completing that master's, I met a man who was to become my husband. He is also a physiotherapist. And he, at that time, got a job that took him to a small country off the coast of Indonesia called East Timor. And this country had been coming through a period of civil unrest, and the UN was there and the Australian Army were there, and they were rebuilding the country. And it was my husband's job to look after the health of the Australian Army members that were over there at the time. So I followed him over. It was a good thing to do in the end because I did end up snaring him as my husband. And while I was there, I had to keep myself busy. So I set up East Timor's first ever physiotherapy practice. And my patients were the thousands of expats working there with embassies, with government organizations, with charities, with police. So yeah, I was looking after all those people. But I guess the interesting turn in the journey came 3 years later when we had to leave East Timor and come back to Australia. And I felt a huge duty of care to the people that I'd been looking after. And I wanted to be able to continue to care for them and their injuries. So I said to my husband, I reckon if I could speak to them and hear what their symptoms are and work out the diagnosis from there, I could give them a rehab plan to follow. And I could do all this without putting my hands on them. I think I could do this online. So that was now by about 2010, 2011. And my husband said, you should do it. So I decided to set up the website Online Physio.
Nice, nice. But how TDS was perceived at first by your patients?
Yeah, it's so interesting because I think what we need to remember is that at that time, my patients weren't people who could visit the clinic down the road. They were people who would otherwise not have any access at all to somebody to professionally assess their injury and tell them what the right things to do would be. So, of course, these people were thankful to be able to access someone who had the right clinical brain to work out what was going on. The people in these sort of roles in remote places overseas are very self-sufficient and they're very happy to do exercises and rehab. They just want to make sure that they're doing the right thing for that
Mm,
injury. So yeah, so the people initially that were patients were very thankful. It was probably more the therapists who raised their eyebrows at what I was doing, because we can be so used to using our hands and it's hard to get your head around not doing that, but still getting someone better.
mm. Okay. Uh, so how TDS is involved now in the Australian care pathway?
So yeah, so over the years, telehealth has been slowly integrating into the Australian health system. It's been used in a small way across a wide range of specialties, mainly in the medical professions, mainly for accessing specialists. But we're also seeing it start to be used in allied health, so speech therapy, psychology, occupational therapy. There's even, online dentists that assess your teeth online. So,
Mm,
it's starting to come into it. But the big limiting factor has been people would have to pay fully out of their pocket. There hasn't traditionally been a lot of funding or insurance coverage
okay,
for these online consultations.
okay. It's clear. So now, Karen, could you share us your 12 years experience in telehealth practice? What are the benefits and what are also the limits of such a practice according to you?
Look, it's a really good question, and I think when I first started doing consultations online, I had to work out how how do the consultations behave the same way as they would in person, and how do they behave differently? And then that has a flow-on effect for how we make packages or price for online consultations. So at the start of every consultation, I'm sure it's the same with you in France, you have a series of questions that you would ask the patient. How long have you had your injury? How did you get it? What makes it worse? What makes it better? How bad is the pain? Have you tried any treatments for the pain? All those normal questions that we ask. Well, of course, that can be very similar, just doing it via video. But then I thought again that I ask very much similar questions each time. Can I put these questions into a form that people fill out before we get on the video call? So, that's something I added over time to save me a bit of time and to
Mm,
allow the patients to start their consultation any time of the day or night. Uh, the next stage is looking at the assessment. So traditionally, we would want to put our hands on someone and feel where it's painful and move their limb to do tests, to test ligaments and to test the joints. So now it becomes about using better communication skills to direct the patient on how to perform these things on themselves. So I'll get them to tell me the general area of the pain, but it might be prompting someone to sort of say, okay, so where in the elbow? Is it at the front? Is it on the inside? Can you feel that knobbly bit of bone there? Oh, yes, that's tender. You're then learning that when you can't put your hands on, their hands have to do the work. Put your hand around the back and run it up here. The person does that. No, that's all okay. But this is tender. Yes, this is tender. If you trace that down, oh, yeah, that's very tight and tender. So it's also educating the patient on their own body and what they're feeling. And for movements, it's asking them to do those movements. And for the few tests that we can't do and we can't teach the patient to do, how have we collected information that will fill the whole of that one test? Because we collect such a wide range of information. And I think sometimes we put too much emphasis on one small test in terms of how we decide to diagnose. So then it becomes about exercise, and I tell you, my online practice was revolutionized when systems like great technical exercise prescription softwares came out, made a big difference for us, absolutely huge. And then how do we follow up online? Well, I can tell you the creation of a secure online messaging feature. I use that a lot. So traditionally we would wait for a week. You see a person, you have the appointment, you wait for a week, you see them again. But secure online messaging allows us to have a more frequent interaction. It's only short, it may just be one question, but we can have more frequent interaction. So how is it different? And that's one of the real benefits, I think, to technology. I still need to put limits on when I access those messages. You know, I don't want to be on my phone all day, but
Yeah.
I say to my patients, I will get back to you within 24 hours on working days. So they have an expectation set of my response time, but rather than waiting a whole week for the next appointment, we've already sorted out that problem quickly. Their pain was up, we reduced their exercises, and now they're on the right track again. So that's a very long answer, Boris, but I think the short answer is some is the same, but also some we just need to adapt a little bit, but it can all be done from start to finish online.
Hmm. Thank you, Karen. Yeah, it was the heart of the interview, so I'm happy that the answer was quite complete.
Good.
Mm, Karen, back to you, back to the interview. My next question is, why did you decide to launch your own training program on online physio?
Yes, so because I started my telehealth consultation so long ago when no one really knew about it or cared. I was sort of out in the wilderness by myself. But as the years pass, the interest in telehealth has increased. And over the last 2 to 3 years, I started to have more and more health professionals ask me, how did you get started? And how do you do these online consultations? And what video software do you use? And what equipment do you need? And so I started to create videos and blog posts to answer these common questions. And then I realized there's a need for people to have this comprehensively all in one place so that they can learn how to do this as well. I'm of the point of view, Boris, that the better quality the telehealth industry is overall, the better it is for all of us. So if I can help other health professionals to do a great job of online consultations, more opportunities will open up for us all.
Okay,
So
so
yeah, so the program, I might clarify, it's called How to Set Up a Telehealth Service. So very straightforward, and it does what it says.
So, Karen, two small questions about that. Is it accessible from France? And how does it work exactly, this training program?
Yeah, so it's a cloud-based login, and I must say it is in English. So I'm apologies for the French speakers out there, but it is at this stage in English. But it is on a cloud-based login, so
Okay,
anyone can access from anywhere.
okay. Thank you, Karen. So now the next question is about the situation linked to the COVID-19 and how it has changed the view of physiotherapy online.
Yeah, well, it's such a great question, and I think as you have noticed too, Boris, there was an immediate shift almost overnight in Australia when our lockdown really commenced. So we were told to self-isolate at home overnight, basically, and suddenly the interest in telehealth went through the roof as physios decided, was it safe to continue to treat patients in person, or was there an alternative? And fortunately, because I'd had the experience over a number of years, I had been able to work with our Australian Physiotherapy Association to get education to all of our therapists to be able to make the transition. And I think along with that, two big things happened. Suddenly, health consumers were much more open to telehealth consultations, and also our insurers and funding bodies were now happy to provide rebates and funding for online consultations where they hadn't before. So we have been asking for this. A small few of us have been asking for funding for years, and suddenly with COVID-19, nearly all insurances enabled funding for telehealth consultation. So obviously that makes a big difference. Our real task now is to do a great job of it so that after COVID-19 is over, we still have access to these rebates and this funding for consultations.
Okay. And now, how do you imagine the future of your job after this COVID-19 situation?
Yeah, look, I really love this question. And I think for therapists out there listening, I think it's very important to state that online therapy will never put in-person consultations out of business. That will never happen. Trust me, we can very happily coexist, but it just gives our patients more choice, and it gives people who have difficulty accessing through, physical disabilities, illness, distance, or just convenience, it gives them another option. I think many people who've tried to convert to online consultations during this time, many of them will adapt back to their in-person clinic and may never do telehealth again. But there will be a group who've seen the opportunity, who've seen how effective it can be, and are able to develop their pathways to make it a more streamlined online practice. And I think it gives a really good opportunity, Boris, for niches. So people who have a real specialty in a certain population, it may be a particular sport or even a particular age group within a particular sport at a particular elite level. They can be the go-to person almost worldwide for that condition. So I think there'll be a great ability to get specialist information into specialist groups where it's needed, where we were limited by geography before. So it's very exciting, but the challenge is there will be much more competition now. So much more people will set up telehealth services. How are we all going to set ourselves apart from each other? And I think that's a challenge that we're facing.
I love your answer, Karen. I love your answer because in France, a lot of physiotherapists, they are afraid by being replaced by technology. So I like the answer, and it's your first word. Telehealth won't replace a one-to-one consultation, and it's just the game is to provide more options for the several reasons you just said. So thank you for that. And one last question, Karen. Do you have any advice to share to French physio?
Absolutely. Now, as a therapist, you always have family and friends ringing you or asking you for free advice. Well, now is their opportunity, but you have to practice it through an online consultation. So set up just a free conversation with them, trial a good video software to see how it works, practice it, and you might surprise yourself with how much of your knowledge is in here as opposed to in here. I mean, you would even find your friend rings you up and says, I twisted my knee, I went down this way, it's feeling this way. You can generally give them some advice on the phone, right? This is just scaling that up. And I find that all therapists, even after just trying one consultation, the understanding of how it works expands a lot. The learning curve is steep. So just try it with family or friends for free to see how it works. And then from there, you can work out, is this something I want to develop? And see it as another tool in your toolbox, not taking away all your other ones, but just enhancing what you're able to do. Probably the final thing I would say is that there will be opportunities for what we call a hybrid model, where you may see someone in person, but then do some follow-up online. That can be a good option as well, especially for people traveling and all of that sort of stuff. So there's a lot of different ways that telehealth can look. You just have to trial it to understand it.
Okay. Thank you so much, Karen. The
No problem at all.
advice was great. The advice was great. Yeah. So thank you, Karen. Thank you very much. and I wish you the best for the future. And
Thank you so much. Thank you for your
yeah,
time, and thank you for all that you're doing for telehealth in Kinesiothérapeute in France.
in France. Yes. Okay, so see you, Karen, and
Merci beaucoup.
maybe, yeah, avec plaisir, à bientôt.
À bientôt.